Some activities you can do include swimming, you can go for a light walk, you can dance, and then you can ride a bicycle. But listen, if you've never ridden a bicycle before you were pregnant, don't say Nurse Onyi sent you to go get a bicycle and ride it, because if you have not ridden a bicycle before and you get on one, you're going to fall, and I didn't send you. So make sure you do activities that you are comfortable with, skilled in, and able to accomplish without losing your breath or harming yourself. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. I am on a quest to make all moms and dads across the world informed participants in their own healthcare. So if you have not done so already, make sure you hit the subscribe button and turn on your notification bell, because that is how you are made aware of every time I upload a video. Now, before I jump into today's video, make sure that you are working side by side with your preferred healthcare provider so that the best care plan can be created for your needs. Do not use these videos as diagnostic tools to determine what kind of healthcare you need. Keep in mind that these videos are for educative purposes only. Now, as you can tell by the title, today's topic is going to be on pregnancy-induced hypertension, which is simply high blood pressure that a woman deals with while she is pregnant. Upwards of 1 in every 10 women will deal with hypertension during her pregnancy, making the topic one that needs to be discussed. Now, I can go on and on about the effects of hypertension in a non-pregnant individual, but pregnancy is different because it affects more than a woman and can have very significant effects in the unborn child. For example, a child born to a woman or carried by a woman who is dealing with pregnancy-induced hypertension can suffer from very low birth weight. These children also tend to be born earlier than they are supposed to because the blood pressure causes developmental issues in the child. This is because during the development of the placenta, because a woman's blood pressure is so high, the placenta does not develop very well. If a placenta does not develop very well, it then becomes incapable of carrying the right amount of nutrients or oxygen to the developing baby. So then you understand why it makes sense that the baby does not gain the right amount of weight, nor can the baby sustain its self-care until it is delivered. Although the cause for pregnancy-induced hypertension is generally unknown, there are still some factors that will predispose or cause a woman to be more at risk to deal with it. And those factors include being overweight or obese, being pregnant with multiple babies, dealing with diabetes, whether before or during pregnancy, a family history or personal history of pre-existing hypertension, being African American in origin or just being Black, and also being older when you get pregnant, especially if this is your first pregnancy. So women who are over 40 tend to have a higher risk of dealing with PIH, and also women who are younger than 20 can deal with pregnancy-induced hypertension as well. Now, pregnancy-induced hypertension is not something that should be taken lightly at all. If it is poorly managed or not controlled at all, it can lead to seizure. It can lead to placental abruption in the woman, which is when her placenta separates from her uterus. Once the placenta separates completely from the uterus, it cuts off your baby's oxygen supply completely, putting the fetus's life at risk. And then for mom, it can lead to increased bleeding, and that constitutes a medical emergency. It can also cause a woman to have a cesarean delivery. So it's very important that pregnancy-induced hypertension is addressed very quickly and very appropriately in a woman. Now, there are some signs and symptoms that accompany pregnancy-induced hypertension. If a pregnant mom deals with any of these symptoms or a combination of these symptoms, make sure you communicate with your healthcare provider so that he or she can monitor you and determine whether you are dealing with PIH or something else. And those signs and symptoms include being tired very easily. Pregnancy tired is one thing, but hypertension causes a fatigue that drains a woman almost completely. Also, if you are dealing with nosebleeds, make sure you let your doctor know. Yes, a woman carries more blood volume while she is pregnant, but if you're dealing with frequent nosebleeds, that can be a sign that your blood pressure is very high. Get that checked out. If you deal with severe chest pain, make sure you let your doctor know. If you deal with shortness of breath, that can mean that your blood pressure is so high that it's pushing fluids outside into the lung area, and because your lung cannot expand fully, it's causing you to be short of breath. So let your doctor know that also. If you deal with headaches, especially pounding, painful, severe headaches, you want to get that checked out immediately. Headaches are one of the most cardinal signs with pregnancy-induced hypertension. And then blurred vision, because those tiny little blood vessels that make your vision work can become over distended and overworked when your blood pressure is very high. So if you have a hard time focusing in on different things, make sure you call that to your doctor's attention, and he or she can look into it to make sure you are not dealing with pregnancy-induced hypertension. Now, there are some things that moms-to-be or pregnant moms can do to help them either manage pregnancy-induced hypertension or to stop it from occurring, and that includes eating a healthy diet. This means you want to eat a diet that is rich in fruits and vegetables. You want to make sure that you are limiting how much junk food you are eating. Avoid fast foods as much as possible. And if you can, make sure you stay away from canned foods. These foods tend to be very high in sodium or fats. They tend to be fried, and these things can easily compound high blood pressure. You want to avoid them as much as possible. Make sure that you are staying hydrated, but don't overdo it, because if you drink too much, then your body will be forced to retain that water, especially in the presence of sodium, and it can cause you to deal with swelling. So drink enough, but don't overdo the drinking. Make sure that you get the okay from your doctor, and if your doctor clears you, then you can try to exercise 3 to 5 times a week. Make sure that the exercise is moderate aerobic exercise, which means it gets your heart beating, gets you sweating a little bit, so that you can actively maintain a healthy weight. Some activities you can do include swimming, you can go for a light walk, you can dance, and then you can ride a bicycle. But listen, if you've never ridden a bicycle before you were pregnant, don't say Nurse Onyi sent you to go get a bicycle and ride it, because if you have not ridden a bicycle before and you get on one, you're going to fall, and I didn't send you. So make sure you do activities that you are comfortable with, skilled in, and able to accomplish without losing your breath or harming yourself. Also, make sure that you are getting adequate sleep. Sleep helps with stress control, and you want to limit the amount of stress that you put on yourself, because stress can compound high blood pressure. Make sure you are limiting the amount of caffeine that you are consuming, and avoid alcohol at all costs. If a mom deals with pregnancy-induced hypertension, her healthcare provider may work together with her to see her more frequently, just to make sure that her and baby are doing okay throughout the pregnancy. That may mean more ultrasounds. You may need a closer monitoring of your kidney and your liver function. Your doctor will check your weight to make sure that you are not swelling or retaining water. Your doctor may also ask you to go get eye exams, because those are very necessary if you're dealing with high blood pressure during pregnancy. If exercise and diet alone are not working to help control your blood pressure, then it may be necessary for you to have medication. If that is the case, your doctor will consider your health condition and prescribe a dose that will work to help keep you within a normal range. Now, if you have learned anything in the content of this video, make sure you give it a huge thumbs up, hit the subscribe button, and join this growing community of learners who are active participants in their own healthcare. And also, do not fail to share it with somebody who you believe can learn from it. I wish you well in your pregnancy. I wish you well if you are trying to conceive. Stay healthy, stay strong, and I will see you all in the next video. Be blessed.